Visuals. McMaster recognizes and acknowledges that it's located on the traditional territories of the Mississauga and Haudenosaunee nations within the lands protected by the Dish with One Spoon Wampum Agreement. And as somebody who grew up in this region, I really appreciate the importance of this territory in my own personal development and remain committed to working with everyone across this region to be able to preserve this territory for future generations, and I'm happy to do so. So today, I'm particularly grateful to welcome you for the kickoff of the 2021-22 seminar series from the McMaster Institute for Health Equity. And we seek to present timely health equity focused research on a diverse range of topics relevant to researchers, students, and staff, and community members across a wide array of disciplines and backgrounds. As I mentioned, I'm on leave this year from my position as MIHE director, but I'm delighted to make an appearance today to introduce our first speaker of the year, Dr. Marisa Young. Dr. Young's an associate professor in the Department of Sociology at McMaster, an early career fellow at the Work Family Research Network, and a Canada Research Chair in Mental Health and Work-Life Transitions. Dr. Young's research investigates the intersection between work, family, and residential context to bring a greater understanding to social inequalities in mental health for parents and children. Her contribution to work and family scholarship has also been notably recognized with several nominations for the prestigious Rosabeth Moss Cantor Award for Excellence in Work Family Research. She's also received the 2017 Ontario Early Research Award. We are also very pleased to have Dr. Young as acting director of the Institute for Health Equity this academic year. And now I'd like to pass it over to Marisa, and where she's going to begin by talking about a little bit about a new initiative she's leading that's going to partner with the Institute. And then she'll be moving on to her talk, which is on family-friendly community resources for better balance, health, and well-being. Take it away, Marisa, and thank you.
Thank you, Jim, very much. And thank you, Lindsay. It's great to be here. I'd also like to thank Equity Burke and Rebecca Hessels from the Gilbrea Center for advertising this talk. And by the looks of it, they did a good job. So thank you all for attending today. As Jim mentioned, I have taken on the role as acting director of the Institute for this year. I'm grateful to be able to do so. Working with Lindsay is also such a treat, and we have a number of endeavors we want to take on this year, particularly around some of the themes we want to develop through the Institute, specific to housing inequality, income inequality, racial inequality, as well as children's health and well-being. And then the final theme that we really want to develop that I'll lead through the Institute is around mental health specifically. And so on that note, I'm going to transition into my PowerPoint slides here, which I'll share with you, and just talk a little bit about what exactly this is going to look like moving forward. So as Jim mentioned, as Jim mentioned, there is an initiative that I've taken on, my team and I, to develop, which we are calling the Initiative for Advanced Research on Mental Health and Society. Eventually, we hope to develop this into a center, but it is not approved yet. And so that's why we're calling it the Faculty of Social Sciences Initiative. And this is what we're hoping will be under the umbrella of the Institute around the focus of mental health, and to help develop really an understanding of mental health from a social science perspective, and draw attention to a lot of the great work that we're doing in the social sciences around mental health and well-being. And so as you can see here, the goal is to really understand from that perspective how we can better address mental health problems. And so I encourage you to follow us on Instagram, Facebook, and Twitter, and hopefully if you're not already. So we will be talking a little bit more about ARMS throughout the year in the Institute and how the two will partner together in order to bring a number of events and hopefully collectively research, faculty, staff, and students together. The focus today, though, and this is one of the pillar projects under the Advanced Research for Mental Health and Society, which we'll use the acronym ARMS, is a study that my team and I have been working on for the past few years. And this is really sort of one of the central areas of my research program, which is on family-friendly community resources. And so I'm going to talk specifically about this project today. And in doing so, I just want to set the landscape for how this research came about, and particularly from an upstream approach of mental health. And so you can see here the well-known Kaplan upstream versus downstream approach to understanding individual and population health. And really the focus of my research is looking at neighborhoods and communities, and the interventions that need to be from that point targeted in order to help individuals' health and well-being. And we know to date that a lot of the research that's understanding neighborhood and community context doesn't really capture Canadians' experiences specifically. And so our very own Jim Dunn has done a lot of work in this area in order to expose that we need to take a different approach in Canada to better understand residential and community impacts on health. And so one of the things that we can begin to look at is, instead of kind of a disadvantage and disorder or deprivation approach, is more a strength-based approach that looks at what is it that communities offer us. So it's not the absence of resources necessarily, or the implied absence of resources, but instead, what are the resources in our area? And what Eric Kleinenberg calls this in his book, Palaces for the People, is really the social infrastructure that we find around us. And so this is the actual institutes that help bring people together in order to gather, network with one another, that can help bolster individuals' mental health and well-being while reducing stress exposure. And so we sort of draw upon these perspectives in order to develop our understanding of kind of what family-friendly community resources look like and how they can impact our research. And so from this perspective, we then consider the interacting contexts that might impact mental health. And so for my particular interest, it's around the work-family interface. And so there's a lot of research that's been done on work stressors and resources specifically that impact mental health. And then there's research on family, different demands and resources, and the ways in which these two interact. And so a lot of work has been done around just work-family conflict specifically. But what I like to bring into the discussion and equation here is, of course, then the communities in which we live. And so if you think about it, these are three of the primary institutes with which we engage daily. And my argument would be that we can't consider one without the other. And so this is where it brings me to looking at the work-family interactions that we have on a day-to-day basis and how communities influence us. So this is where I will make the argument that it is important to look at work-family conflict for a number of reasons. This is one of the most pernicious stressors that we can see individuals experiencing on a daily basis. It's considered a chronic stressor that's insidious without no necessary start or end point. We know that 8 out of 10 people experience at least moderate levels. And it's very true that COVID-19 has amplified these situations, right? And so normally I would emphasize a study that came out of Stanford in 2015 by Joseph Go, where work-family conflict actually ended up ranking higher in terms of predicting poor mental health compared to unemployment, job demands, or even exposure to secondhand smoke, for example. But in the context of COVID, I think if we have not, we are still experiencing the unfortunate consequences of work-family conflict, working from home or remotely, as well as trying to engage with the family obligations that we have. And so that's why the presentation of this image here is from a New York Times article that was published back in February, where it documented 3 women's circumstances, 3 mothers in particular, where they really were on the brink of a breakdown. And it, I think, best captured the different experiences that mothers in particular were facing during COVID, and how work-family conflict has really come to the forefront. We were not aware of this stressor before. I think that a lot of people have been now, based on the attention that it's been given. And so I just pull a couple quotes from this article. to make it, I guess, more applicable to why work-family conflict is not necessarily a trivialized stressor experience by professional women only, but really is something we need to focus on to better understand mental health on a day-to-day basis. So one of the references here, Dakita says, in a nutshell, we are holding together with the same tape that we have been using since March. The tape is barely working, but we are still here. Another quote, I'm trying to find out how I can be more organized with work, but also how to be more present as a mother and wife. But then I'm like, oh crap, what about me? Where do I fit myself in, right? If we're thinking about self-care and mental health and well-being. And then finally, one mother admitting we can't have the breakdowns we need. I have to keep it together for everyone else. And this might resonate with a number of you, but definitely does bring sort of work-family conflict, as I mentioned, and its importance for predicting mental health to the forefront. And the reason that I am spending this time right now kind of, I guess, justifying work-family conflict is, as you'll see today, that is the focal outcome that I look at, but from a stress process perspective. And so it's important to understand how we can better remedy work-family conflict levels before they lead to outcomes of high mental health problems. And so that's what I'll be showing you today in my research that we've been developing, looking at how then residential communities can help individuals negotiate work-family conflict. Some of the previous research that I've done in this area looks at specifically those deprivation models I discussed before that focus more on the physical and perceived disadvantage of neighborhoods, or something that's called to structural amplification by Catherine Ross. And so this is where, in fact, the context in which you live tends to decrease the psychological resources you would otherwise have to deal with stressors. And so not only do you have this direct impact of these disadvantaged neighborhoods, but you also have the compromised resources that you would otherwise use to combat other types of stressors, such as work-family conflict. I've also looked at how individuals who live in close proximity, the different characteristics similar to one's own, can actually form what's called by Ronald Burt a level of structural equivalence, where individuals begin to adopt the same sort of values, behaviors, and understandings. And so what is kind of considered normalized in the neighborhood can help to decrease our perception of stressors. And the examples I use is that those mothers in particular who live in a neighborhood with other mothers with young children, the idea that there's a normalization of work-family conflict experiences. And that's not necessarily because they're not experiencing the conflict, it's just everyone is in the same boat. And so it doesn't seem as much of a stressor because you're not in an anomalous situation. Finally, and what I build off of today is some of the work that I've done on looking at objective versus perceived community resources. And this resonates a lot with the sort of perceived support literature in mental health, whereby the very notion of believing or perceiving community resources and help around one's community actually can help to combat the perception of stressors. And so it's that same idea of if you feel that you're in a supportive community, whether you actually use those resources or not, it helps to alleviate some of your mental health experiences. And the reason that I had to rely on perceived community resources is because, and what has led me to the current project, there is not a lot of data on the presence of resources in neighborhoods, right? And so that's why too, previous literature has really focused on more deprivation models because it's easier to then use, for example, census data in order to kind of capture some of those characteristics of neighborhoods that would divide them into advantaged versus disadvantaged. And again, then implying the absence of resources. So the goal of this project is to then actually accumulate and collate in a number of ways resources, information on resources across different regions of Canada over time, so that researchers can have a better grasp on and opportunity to actually measure how communities impact mental health and well-being. So some of the key goals of the Family Friendly Community Resources Project includes then generating and testing a family-friendly community resource measurement tool, which will then be made available and is soon to be made available, I guess I should say, for public use. And so this will be provided on the website, which I'm going to show you too in a moment. Creating a public data repository of community resources. And so the goal of this is so that, you know, our team is going to do the legwork for others, and you will then have the opportunity to download and use these data that have been cleaned and coded and can then be matched based on geographical identifier with perhaps individual level data you're working with. One of the caveats of this project is that we're working with census divisions. And so this is a geographical unit that is larger than what is normally used in neighborhood and community-based research of a census tract. And so that's one of the things I can talk about a bit more too during the Q&A period. One of the key goals of this project then too is to test the impact of community resources on individual health and well-being. And this is where data does not exist really to offer the opportunity without matching to individual level data, which is what we do here in this project and what I'll be showing you some preliminary results. And I'll talk a little bit more about this individual level data set, but it's a longitudinal data set. Longitudinal data set. The PI is Dr. Scott Sheeman from the University of Toronto. I've been working with these data since the early days of my PhD, and so I'm very familiar with them, but I'll talk a little bit more about some of the measures that we can then use from those data in order to test individual level outcomes. So today's presentation, we're going to do a bit of an overview and understanding of the data available in Canada and how to use these data. And so again, as I've mentioned, the limitations in the past of research on community and neighborhood effects is oftentimes the absence of data. And so this is where we're hoping to fill that gap. One of the things too that I want to share with you today is sort of more beyond the substantive findings, a methodological lesson of how when we do incorporate multiple contexts as well as consider community resources simultaneously over time, we see much different results than if we were to take just a snapshot. And so incorporating time and space into these analyses is very important. And then finally, of course, the substantive contribution of trying to understand residential context and the ways in which that impacts the exposure and vulnerability to stressors with a particular focus on work-family conflict. And so one of the things I just want to acknowledge quickly is, so our website that we have now up and running, and I encourage you to go and review. But one of the things that you can see on the website is not only a research overview, but one of the things that I would like to acknowledge is our research team. And so very fitting to this presentation, it takes a village. And so I want to first and foremost thank Dr. Diana Singh, who is the research coordinator and my postdoctoral fellow. She's been working on this project since 2019, and we wouldn't be where we are without her. And Wisha Sikder, she's been helping do a lot of the data analyses. Sean Lepe, he is the go-to geographer for the project, and so he's helped a lot with some of the mapping as well as the coordination and coding of the data. Jessica Monaghan has also been helping not only with this part of the project, but the youth engagement program that we have as part of the project as well, where we do outreach to high school students to help them understand some of the research that we're doing for the project and try to encourage them to better understand that side of university. And so she's been an expert on that. And then David Vaz, who is wonderful in terms of all of our social media, as well as the website development. And so I just wanted to give an overview. Thank you to all of them and the hard work that they put into this project. So just a bit of background here of what we sort of had to do in order to get to where we are today is, imagine you have all these disparate pieces of data out there that no one has collated, and we have to find them first and foremost, and then we have to clean them, and then we have to try to match them. And this is, again, as I've mentioned, not only in one area of Canada, we're trying to do all regions of Canada, and we're also trying to do it over time. And I'm going to talk a little bit about that time component in a moment. But to tell you where we are, we have what most people start off with, which is the census data. And so this provides us with a general overview of different characteristics of individuals based on census tracts and census division. We also have crime rates from Statistics Canada that we've now been able to clean and combine. Budgetary allocation based on some provinces. This again is only at the provincial level, and so we're trying to figure out how we can get more information based on the municipal data. Labor force data. So this was outputted from the Research Data Center, and so we have that for all years. We have a lot of information and data on libraries, actually, so the number of libraries across different areas, but this is primarily for Ontario and Alberta only, so we're still working on trying to gather that information for the other provinces. And then we have a lot of information on publicly available childcare. The problem is across all provinces, these data aren't kept encoded or collected or kept in similar standard forms across provinces by years. And so this is taking a little bit more cleaning than anticipated. Of course, then we have aggregate data that we've compiled from the individual level data I'll talk about, and election data for the relevant years. But most of our data that we've been working with to date come from DMTI Spatial. And so I'm going to talk a little bit about these data in particular and where they're from and why, for example, there are a lot of researchers who haven't been using these data to date, because it is very much a rich source. It just takes a little bit more legwork, which is what our team is hoping to do in order to use those data. And so this is an example of how you would look at the data on Scholars GeoPortal. So while these data are available for purchase through the DMTI website, most universities actually then, provide the data through standard purchase license. And so in order to use these data, we have recommended a number of standardization approaches so that you're not working with the dirty data. And so I guess the way that I should start this is DMTI data are very dirty. And so they tend to have multiple different codings for the same resources. For example, if you're looking at education compared to a hospital or mental health facility, you might have to go through and find the appropriate code. So if you think of something like McMaster University, that has not only education resources, it also has nearby childcare, it also has nearby the hospital. And so there's all these different tags that are placed on McMaster University itself that then do require a little bit of coding and cleaning. And so Sean and I have actually put together a paper that's under review right now, looking at the best practices for using DMTI spatial data. So we also think that this will be helpful to a number of researchers, and if following sort of a 3-stage standardization where we provide an overview of the, again, best practices. So I won't go into detail here. I talked a little bit about that at the Canadian Sociological Association meetings, but we do think that this will be a great way that researchers can better utilize what we think is underutilized data. Okay, so now measuring the impact of community resources on individual level outcomes. This is what brings me to talk a little bit about the individual level data that we will be using and comes from the Canadian Work, Stress, and Health Study. This has been collected over 5 waves. And so from 2011, every second year to 2019. These years then define the years of which we're collecting data at the community level. And so you can see the ends here across the different waves, and there's key characteristics on work, family, health, and well-being, particularly work-family conflict. And so while there are a number of outcomes that we've looked at to date right now, in this presentation, I'll be focusing on the results when estimating work-family conflict. At the community level or regional level, the resources that we're using from the DMTI data include information on food stores, education resources, recreation facilities, religious organizations, and protective services. There are a variety of other resources that the DMTI data include, but after going through them and cleaning, we found that these were the most valid and reliable of the offered resources that we could use. So getting into some of the methods and results. So one of the things I'm going to show you first, and just a mini methodological lesson, is the interclass correlation for work-family conflict. And this is basically just the amount of variance that we can say is explained in work-family conflict by some community level predictor. And so looking at the map here with the various levels of work-family conflict across the bottom, 25% to the top 25%, we find in fact that 12 to 16% of the variance in work-family conflict is explained by something at that regional community level. And so this is actually quite a bit when you consider sometimes the amount of variance we explain in our models using cross-sectional data. This is actually quite a bit that talks and does explain then away the regional level variations in work-family conflict across Canada from these data. And I should say this is based on the 2019, so the most recent data of the CanWISH. So in order to test then the impact that community resources have on these outcomes, we use what's called hierarchical linear modeling. This is the fancy formula in order to simply show that we're looking at two different levels. We're basically saying that at the individual level, we have these different predictors, and at the community level, we're going to see how that influences our outcome of work-family conflict. And here we can see some of the results when we're looking at individual level waves and resources separately. And so here from the DMTI data, we have the food stores and the impact on work-family conflict at wave 1, 2, 3, 4, and 5. And so you'll note here that we start to see some statistically significant results. So this is suggesting that food stores doing decrease work-family conflict. But you can see that there's some inconsistencies as we get to waves 4 and 5, that we don't see any impact. And similarly with education, we don't see education resources having any impact either. And so when you run these results, especially after, collecting and coding and cleaning these data, right? And you're like, well, this is a bit strange, because you would expect, for example, education in particular would have an impact. Recreation facilities too, we can see inconsistencies here where there is a statistically significant effect at wave 1, suggesting that the number of recreation facilities in an area decreases work-family conflict, but that's only at wave 1 and doesn't exist for the other waves. Religious organizations, we only had data for the last 3 waves, and we don't see any impact there. With some of the safety or protective services, we can see that there's the one statistically significant impact at wave 2, but that's it. So our conclusion is that, and this is one of the methodological points I wanted to make, is when we're looking at the different resources at different waves without combining this all together, we can find inconsistent results, right? And this might be because what we need to do is consider this in a more, combined approach over time. And so that's what we do next, where we actually use growth curve models in order to understand how individuals are not only embedded within their context or residential areas, but also that there's multiple time points that respondents have reported work-family conflict. And so this essentially is just saying, instead of having the 2 levels that we want to look at, saying individuals and neighborhoods, we are actually looking at the various time points of individuals' responses within those neighborhoods. And so this is called sort of accounting for then not only time, individual variables, and then also the regional variables. And so what we find here then, using a person period data set, is the main effect of family-friendly community resources combined over time. We see that there is in fact a decrease in the trajectory of work-family conflict reports over time. And this remains consistent even when we account for a variety of different control measures, including census level measures of disadvantage. And we can see that that result still remains and is statistically significant. So what does this mean? If we end up thinking about, for example, a mother with 2 children who had work-family conflict levels starting at 3.5 at wave 1, what we're looking at here is basically a continual declining trajectory of work-family conflict as the resources in the community increase. And taking that into consideration over time, we can make a pretty strong argument that the amount of resources collectively do impact work-family conflict levels, but this impact is best seen over time rather than in a snapshot, which is why looking at the 5 waves separately, we don't see as strong of evidence compared to what we see with the growth curve models looking at all of the waves simultaneously. And so this is where I'll leave those preliminary results and just talk a little bit about then what we have coming up next. And so just in conclusion, just once again reiterating, which I have been, that where we live obviously does matter for our experiences of stressors and well-being, and particularly for work-family conflict, which, as I noted at the beginning of the talk, really the impact of work-family conflict, I think, is overlooked and sometimes trivialized, but really needs to have more attention paid to it. If we can reduce levels of work-family conflict, especially amongst mothers with young children, we can, I guess, make sure that mental health and well-being amongst this population declines overall. In order to look analytically at some of these results and how neighborhoods do matter, we want to use a more comprehensive understanding of community resources generally, as well as incorporate longitudinal approaches rather than trying to look at, say, a snapshot model. Some of the next steps that we're taking from this, other than continuing to clean and combine the data, we're also wanting to look at who uses these various community resources. So our team is now partnering with some local organizations, including Canadian Mental Health Association and Hamilton Public Libraries, in order to access and help them collect data on who is using some of their resources, attending some of their programs, etc. These organizations have already done an amazing job in collecting the data themselves on the different characteristics and demographics of program participants. But the problem is sometimes not having the time or the skill sets to actually analyze those data. So this is the same as we had posed with the Family Friendly Community Resource Project. This is an opportunity to go in and be able to kind of clean code and share the data that is already existing rather than having to collect it ourselves. So I'll leave it there, and hopefully we will have enough time for questions, but I want to thank everyone for coming, and I look forward to hearing from you.
Yes, thank you so much, Dr. Young, and we certainly do have some time for some questions from the audience. If you have a question, please feel free to put up your hand and in either physically in your camera or the raise your hand function, or put your question in the chat box, and then we can read them out loud. Justin.
Hello. I honestly don't really understand most of what was talked about here, but I was just interested to see how like research kind of works. And I was also thinking about going to McMaster and like, because I've had mental health challenges, I'm curious to see what researchers are doing about it. Like, I don't know how much of a question that is, but yeah, that's kind of what I wanted to say. Thank you.
Thank you very much, Justin, and thank you for joining us. And you know, I do understand that this is a little research focused and sometimes heavy in that regard, but I do encourage you to sort of seek out conversations with some of the people who are doing mental health research, definitely at McMaster. And you know, the good thing is there's a lot of variety in our different approaches. And so I hope you can connect with some people, and maybe they'll be able to also offer you some opportunities and advice for what you might want to study at McMaster.
All right, thank you, Justin. I can looking for other questions, other raised hands. There's a big gallery, so if I'm missing you, I think you can just feel free to unmute yourself. And
I think Allison has a question.
I do. Hi. I'm really interested in how I keep going back to the quote about neglecting oneself, and this recognition that how we perceive stress has so much power over how it works, and yet work-family conflict also has this kind of fundamental nature where there's only so much time. And so I was curious if you have more thoughts on how to disentangle some of the power of the perceptions of it relative to also what people are actually experiencing.
Yeah, that's a great question. And that's actually one of the points that I make in the piece I talked of, where who we live around really does influence our perceptions of stressors. And when looking at work-family conflict, you're absolutely right. There's an objective component to that stressor where there really is, time deficit or a zero-sum game when it comes to that. And then there actually is the perception that, you are experiencing work-family conflict. And I think Robin Simon, in one of her pieces, it's a bit older now, but from 1995, actually talks more about how, in terms of the gender differences of understanding and perceiving work-family conflict. And so the way that she speaks of it from her sample is that women sort of view it as kind of constantly present and, overwhelming and all-consuming, right? And so no matter what they do, it's this idea that work and family are constantly not balancing. Whereas men found it to be more acute and specific, right? Or incident specific. So experiencing conflict because they're working overtime, but can't go and pick their kids up from a soccer game. The idea behind it is really the sort of independent and the interdependency of the two roles. And so in this regard, those who see their work as contributing to their family role, which you would in sort of this more traditional model, that men, their financial provision is actually contributing to the family, where women, their work is not really meeting the expectations that otherwise are placed on them for kind of as the family provider in terms of more the caregiver, right? And so it's this different ways in which, they can experience the same type of conflict, but if it's incidental versus all-consuming, that then can take a much more wearing approach on the individual in the latter situation. So how we can change that is, that is definitely a question that I think helps to maybe think about the different ways in which we do normalize stressors, and the ways in which then individuals who are surrounded by others experiencing the same types of work-family conflict, right? It becomes then the social comparison approach, where we're all in the same boat. Now, that doesn't help the objective conflict that happens between work and family, but it does then give us the psychological resources to kind of help change our perception of that stressor and therefore the consequences.
Okay, thank you. Dr. Moffat's next, and then Dr. Fetner.
Hi, thank you, Dr. Young, for a really interesting presentation. And I have to admit, I felt exhausted actually just hearing all the work that you and your team have done going through all that dirty data. It's really impressive. So I just want to ask about, the resources that you were describing were quite formal resources. And I'm thinking about informal resources, extended family or peer groups, or, you know, all sorts of different ways that people cope with that work family conflicts. So I just wonder if you could comment on that, or if is there a way to get at some of those less formal resources?
Yeah, that's a great question. And in the data set at the individual level that we're using, we unfortunately don't have those measures because it wasn't intended really to understand community resources, which again, I think is unfortunate. And as I said at the beginning of the talk, I don't believe that we can really consider one of these institutes without the other, right? And so work, family, and community all need to be, I think, integrated when we're asking these questions about supports. And the idea of extended family as well as neighborly support, those are some of the things that I was able to get at in earlier data sets I've worked with, particularly a neighborhood-based data set out of Toronto, where that's you definitely do see that those who are in more supportive communities when it comes to having those informal resources are far better off. And I think that that's something that needs to be considered in these data and analyses. The one thing that I think really drove, though, our focus was in kind of policy-based arguments moving forward. And so to sort of say, this is where we want the investment in more resources, because this is how we can see it impacting people. So putting more of that onus on the municipality rather than asking people to reach out and find those resources themselves. This again is where we end up seeing that you know, I'm mentioning it quite a bit, the gender divide between the experiences of work-family conflict. And in fact, because a lot of women, and particularly those with young children, do connect with their neighbors and do end up having a lot of those networks already established. So it ends up, I think, masking or underscoring the, or I guess not highlighting to the extent it should, the experiences of work-family conflict that those women have. And so some of the research that I've done around childcare availability actually shows that men who live in neighborhoods with less childcare availability are worse off than women. And the argument is that this might be an artifact of the data because women have been able to form those, and in many cases, they've reached out to make those informal connections and use those informal supports more so than maybe other people. So I think it's a really good comment, and there's a lot of research to be done there. Again, it always comes down to the data aren't available. But I think if moving forward, having a more comprehensive data set that includes the work aspect, the family aspect, and the community.
Yeah, thank you. That's a really good point. And just as you were talking, I was thinking, you know, sometimes those formal resources or like community centers or programs are actually where people make those informal connections. So that's a kind of a proxy in a way for some of that. So yeah, thank you.
Absolutely. No, and thank you. And that's exactly what Kleinberg refers to as that social infrastructure. It's that we need this physical infrastructure in order to create those social connections. And where we see that, I mean, a lot of his work comes out of Chicago, but even during, for example, the heat wave, those that actually did better in terms of being able to survive were those who weren't isolated, and the people who weren't isolated were the ones who lived in resource plentiful neighborhoods. And so you can see that there is quite the impact that, and I would say almost like the unanticipated extended impact of having these resources, these physical resources in the neighborhood to form those informal supports.
All right, yeah, Dr. Fettner, I think you were up next.
Yeah, thank you. I just want to say thank you for this really interesting talk. It's really a great window into the work that you've been doing, and especially to those spatial data that I kind of knew existed, but didn't really have a good sense of what they were. And so thank you. But my question's about these community resources, and really the sort of qualities and characteristics, and whether there are differences between different kinds of community resources. And I've read the Kleinenberg, I'm all in for the libraries, but I understand that the reason that libraries are such a powerful infrastructure for community supports are because they're kind of radically available to the entire community in a way that a lot of other social institutions are not. And like even the early years centers, if I recall correctly, they were only open like, a few hours a day in the afternoon during the workday, Monday through Friday. And it's like, so if you had traditional work hours, you missed out on those. Whereas like libraries seem to be kind of devoted to, access to lots of different kinds of people. And so I'm wondering, in your research, if you have either a sense of work that you've already done or work that you want to do of the differences in the quality of community resources, and whether those sort of differences or whether those characteristics contribute to the reduction of stress the way that you found in previous work.
Yeah, thank you so much, Tina. And thank you also for coming to the talk. I know that you've heard some of these ideas as they've developed over the years. And so I think you hit the nail on the head of where exactly we want to go next. So this is kind of one of the continuous arising comments or questions that I feel we're getting from this study is, it's great to be able to look at the aggregate numbers, but what does that actually mean in terms of the programs that are being offered at, for example, some of those recreation facilities that we can count, or some of the religious organizations that we can count, but we don't really have an understanding of which programs and the quality of those programs. And then in addition to who's using those resources, right? And so this was something that came up, I guess it would have been about 6 months ago in a conversation with Andrea Gonzalez, actually, where she was like, it's really great to understand how, like the actual, I guess, prevalence of these community resources, but who's using them, especially when we start to think about gentrification practices, right? And so a lot of the resources that we find in kind of the urban center, in some areas, when you have, more privileged or middle-class individuals who are living in that area, they're the ones who are using that resource. And I think, almost immediately about where I used to live in Toronto, where the Jewish Center was available to the entire community, but was overwhelmingly used by those who lived close by, which were, those that were of middle class professional status. And so it wasn't really a resource that then was provided for those who were disadvantaged or underserviced. And I think that that's why we want to use this opportunity next to better understand who's using the resources and the quality of those resources. One of the things that I'm so surprised by is when talking with these community organizations, including the CMHA and Hamilton Public Libraries, they have a lot of data on this, but it's just this disconnect between the research community and these community organizations. And so our goal really is to help bridge that gap, because there's so much more that we could do to understand and answer the question that you just asked. We just don't have that collaboration started yet, and we don't yet have access to those data. So I hope to be sitting back here in a year's time and presenting to you on the answer to your question.
All right, Jane, and this might be the last question, or we might have time for one more.
Okay, thank you. Can you hear me okay?
Yes.
Okay, so thank you very much for that talk. It was really interesting, although I too found the maths completely incomprehensible. I wanted to ask a question that follows on from Dr. Moffat's question about informal resources. And I wanted to, what you thought was the role of qualitative research as a complement to this very rich quantitative research that you're doing. And I'm thinking in terms in particular of the storytelling element that's so important when you're trying to articulate these ideas, for example, to decision makers if you're trying to influence public policy?
Yeah, that's a great question. I do need to start to build the collaborations with some of those with better qualitative skills than I have in order to bring that about. And I think that it would be an excellent opportunity because, as you see, you know, I mean, to have some of my research resonate, I pull quotes from articles, right? Or I pull quotes from others that have told the story before. And I think for that reason, because it's much more engaging when you have those personalized stories. And that is what I would love to do from the community resource side of things as well, especially, you know, beyond just focusing on the presence of community resources. I do a lot of work also with Jim, looking at just experiences of and perceptions of disadvantage and disorder in neighborhoods. And I think that's, you know, there's only so much you can gather in a quantitative way rather than asking people how they experience their neighborhoods in a moment in time. And so that would be a great contribution, I think, for sure, if moving forward in trying to engage policymakers, that the storytelling aspect would have to be there. Absolutely. Thank you.
Okay, now, do we have anyone else? Or if not, I think we could wrap up.
I think, Justin, you have another question?
Okay. All right.
Hello. I thought of a question that, so that they're talking about the quantitative like research data, and then there's qualitative like it's being like articulated into words that can be so is most of the quantitative data, is that like from like self-report surveys of people filling out that this is coming from?
That's a good question, Justin. So the some of the measures that I was speaking to around individuals' mental health and their experiences of work-family conflict, those were based on surveys. So what actually happened was there was a team of people who actually called respondents and then asked them if about their different experiences related to mental health. And so yeah, then what we do is assign a number to those responses. And that's what you do see here today is the quantitative result of that.
And then I don't remember who exactly it was that was saying about the qualitative, like telling like a story like about like a community would like I know personally that I like to journal about stuff, and I kind of observe like what's happening in my community. So that would be like, so journalism would be the way that you'd collect qualitative data about a community.
I think that that's a really, that's a really effective way to get people's accounts of their experiences. I would have to ask people who are better qualified in qualitative.
I'm not saying I'm qualified to do it. I'm just saying this is like.
No, I think it's a really good idea, actually. If you asked a bunch of people to journal their experiences of their neighborhoods, that would be a very rich source of data. Yeah, thank you.
Okay, thanks.
Thank you.
All right, I'm sorry, I saw we had one more question, and I think if we make it fast, we can squeeze it in right before we wrap up. That's Nicole, please.
I just want to thank you so much, Dr. Young, for your presentation today. And my question was, like, you had talked about how COVID has exacerbated a lot of the work-family dynamics, but I do wonder when it comes to community resources, and with a lot of things switching to online platforms, such as us using this Zoom meeting today, do you think that in some ways community resources have been enriched through this online sort of transformation? And do you think that that will sort of change or affect some of the research that you're doing?
Yeah, that's really interesting. I think my mind goes in two directions. First, thinking about when communities were shutting down and all the resources had to close, and the impact that that had for a lot of people. And this, I mean, first and foremost applied a lot to childcare facilities, but also those that, recreation facilities that offered after school care, those types of things, right? And so it just, it really was this impactful moment to recognize how community resources are, I think we, maybe an overlooked support in some capacities. That, you don't recognize what you have till it's gone. But for that same reason, the ways that we've adapted in all of these areas of COVID when it comes to work and family, I think we have done so with community too. And so you're absolutely right, kind of these online forums or these different online supports have probably started to replace what we otherwise would build, or going back to Tina Moffat's question about the informal networks, right? We're using now sort of more virtual community resources in order to form those informal supports and networks. So I think that definitely will have an impact. I'm curious to see if we ever get to a post-COVID context, which fortunately and hopefully we will, that the ways in which it has shaped not only then, I guess, the prevalence or the programs that are offered through community resources, but then also to how many people continue to invest in these virtual platforms. Thank you.
Okay, thank you. Thanks everyone for joining us today, and thank you, Dr. Young, for the presentation, which will be available on the Institute website in the coming days. That's mihe.mcmaster.ca, and you can also subscribe for our email newsletter there. And I've put some links in the chat for an upcoming, the first annual symposium for ARMS that Dr. Young talked about. We've got a registration link in the chat, and there's also a calling for student posters. And the deadline for that is September 27th. So please check out the links, and we'll look forward to seeing you at the next event.
Thank you, everyone.